Hello, I'm Dr. Sunil Kutti. I'm a brain and spine surgeon. Today I'll talk to you about hypertension. Yes, all of you would wonder what is a neurosurgeon going to talk about hypertension. I never go to him for the treatment of my hypertension. Yes, that's true. I really do not treat hypertension, but I do treat complications that arise because of hypertension. And usually the complications that reach me are life-threatening. So it's very important that I give you my perspective about it. And to put forth my perspective, I'll tell you one small story. So this story is of two friends, Jay and Viru. Jay was a good kid while Viru was the notorious type. So Jay managed to study hard and got himself an MBA and finally joined a big corporate. While Viru was the notorious types, dropped out of school, had really bad friends, very bad influences, and finally ended up becoming a thief. So Jay was working for a big corporate and had a very stressful lifestyle. So he had no specific times of having his meal, no specific time for exercise, and at the end of it, what happened was he had piled on the kilos, the stressful lifestyle took its toll, and he was soon diagnosed with hypertension. He was advised to take certain medicines by his physician, which he started doing diligently, and after a while his BP came under control. That's when he became complacent and started thinking that these medicines are really not needed, and had started becoming a little bit careless about it. While Viru went about his business of robbing people. Now the story shifts to one particular night when Jay was very busy at his work and forgot to take his hypertension medication, while Viru had planned to rob somebody. So Viru went about robbing somebody. So at the same time, the person whose house he was robbing woke up, and Viru went ahead and stabbed him and ran away with the stash. Now next morning, you had two vehicles come into the building gates where Jay and Viru stayed. One was an ambulance which Jay's wife had called in when she found Jay lying unconscious in the morning, while the second was a police vehicle which had come to apprehend Viru. So once Jay was in the hospital, he was diagnosed with uncontrolled hypertension. Since he was unconscious, a scan was ordered and the scan showed a large bleed. The neurosurgeon was called in and it was decided that he would need a life-saving surgery. At the same time, his wife was explained by the neurosurgeon that the surgery is aimed at damage control and not at retrieving what has been lost, because the bleed had already damaged quite a bit of the brain. In fact, the doctor by his experience knew that his one side would be paralyzed forever, and there was a very good chance that he would be bedridden for life. But at the same time, surgery was an attempt at saving his life by decreasing the pressure inside the brain, which was caused by the bleed in the head. The surgery went off smoothly, the clot was removed, but yes, the damage was already done. Soon, Jay was moved into the ICU and then the treatment continued. At the same time, now Viru was apprehended by the police, case was filed, the case went to court. Viru, who had all the money in the world, summoned the best lawyers and managed to get away with a very small sentence. So 3 months down the line, what did we see? We saw that Jay was still bedridden, dependent on his wife for even basic care, while Viru was almost leading a normal life. With this, I'm not trying to glorify what Viru was doing, but what I'm trying to say is that even the very small mistake of not taking your medications on time or missing it in a case of hypertension could lead to something really catastrophic. And the punishment that you get is far more severe, far more cruel than what you would expect for missing the dose of one medicine. So this is what I want you to remember, because I see it on a day-to-day basis where people just skip their medicine, come to us in an unconscious state, and then we have to do all these things, and still usually the patient is bedbound. So it is very important for you to realize that certain medications are not supposed to be fiddled with, and you are supposed to take the opinion of a physician regularly for that. So with this story, what I'm trying to tell you is, even when somebody commits a heinous crime, there is a way to escape from it. But once you miss out on a medication, there's a bleed in the head. Unfortunately, there is no getting away from that, and you're cursed for life. So that is something which you should be. Apart from that, in the case of a hypertension, it is extremely important that you do not do what all Jay did. So what did Jay do? He got into a good company, excellent. But after that, the stress that was taking the toll on his health was something which he should have avoided. So that's one thing. You should be careful about your health. The weight should be maintained in the right range. You should eat on time. Diet, extremely important. And then the other thing when it comes to hypertension specifically is salt restricted diet. And the most important thing, as I have already pointed out, would be taking medications on time as advised by your doctor. So with this thing, I'd like to end my story. But I hope that I've been able to drive in the message that I really want to convey, that some medicines, yes, you have to be extremely careful with, and if taken correctly, you would save a lot of ordeal in the future. Thank you so much.